Mental health anxiety medication quiz questions. Question 1. During a manic episode, which nursing intervention is most appropriate? Option A. Encourage group activities to increase socialization. Option B. Provide a structured environment with limited stimuli. Option C. Allow the patient to engage in physical activities freely. Option D. Give the patient detailed and complex tasks to complete. The correct answer is option B. Provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. Question 2. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder (ADHD)? Option A. Haloperidol. Option B. Sertraline. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 3. Which drug group requires nursing assessment for the development of abnormal movement disorders in individuals taking therapeutic dosages? Option A. SSRIs. Option B. Antipsychotics. Option C. Benzodiazepines. Option D. Tricyclic antidepressants. The correct answer is option B. Antipsychotics. Antipsychotics choice B are the correct answer because they are strongly associated with the risk of extrapyramidal symptoms (EPS) and other movement disorders due to their dopamine receptor blockade in the. Question 4. During a panic attack, what is the nurse's priority intervention for a patient with panic disorder? Option A. Encourage the patient to verbalize their feelings. Option B. Provide reassurance and stay with the patient. Option C. Leave the patient alone to calm down. Option D. Distract the patient with a task. The correct answer is option B. Provide reassurance and stay with the patient. During a panic attack, the priority intervention for the nurse is to provide reassurance and stay with the patient. This action helps reduce fear and provides a sense of safety, which can aid in calming the patient. Question 5. Natasha's husband died suddenly 2 months ago, and she has been overwhelmed with grief. When Natasha is subsequently diagnosed with major depressive disorder, her daughter, Nadia, makes which true statement? Option A. Depression often begins after a major loss. Losing dad was a major loss. Option B. Bereavement and depression are the same problem. Option C. Mourning is pathological and not normal behavior. Option D. Antidepressant medications will not help this type of depression. The correct answer is option A. Depression often begins after a major loss. Losing dad was a major loss. When individuals experience a significant loss, such as the death of a loved one, it can trigger major depressive disorder. This is because the intense grief and sadness associated with the loss can lead to the. Question 6. When assessing a patient with major depressive disorder, which symptom would most likely be observed? Option A. Euphoria. Option B. Anhedonia. Option C. Increased energy. Option D. Racing thoughts. The correct answer is option B. Anhedonia. Anhedonia, the inability to feel pleasure in activities that were once enjoyable, is a hallmark symptom of major depressive disorder. Patients with major depressive disorder often experience a pervasive feeling of. Question 7. In a patient with schizophrenia, which of the following symptoms would indicate a poor prognosis? Option A. Auditory hallucinations. Option B. Paranoia. Option C. Flat affect. Option D. Delusions of grandeur. The correct answer is option C. Flat affect. A flat affect, characterized by a lack of emotional expression, is often linked to a poorer prognosis in schizophrenia. It can hinder social interactions and affect the individual's ability to engage in therapy or. Question 8. During cognitive behavioral therapy, a 12-year-old patient reports to the nurse practitioner. Option A. I was so mad I wanted to hit my mother. Option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. Option C. I forgot that you told me to breathe when I become angry. Option D. I scream as loud as I can when the train goes by the house. The correct answer is option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. In cognitive behavioral therapy, recognizing and challenging negative thoughts is crucial for progress. Choice B demonstrates the patient's ability to identify and correct distorted thoughts, indicating positive. Question 9. How does emotional trauma typically affect individuals physically? Option A. Emotional trauma is a distinct category and unrelated to physical symptoms. Option B. Physical manifestations of emotional trauma are usually temporary. Option C. Emotional trauma is often manifested as physical symptoms. Option D. Patients are more aware of physical problems caused by trauma. The correct answer is option C. Emotional trauma is often manifested as physical symptoms. 1. Correct answer C. Emotional trauma is often manifested as physical symptoms. When individuals experience emotional trauma, such as severe stress, grief, or abuse, their bodies can respond physically. This. Question 10. A patient with schizophrenia is prescribed clozapine. Which potential side effect requires regular monitoring? Option A. Weight loss. Option B. Hypertension. Option C. Agranulocytosis. Option D. Hyperthyroidism. The correct answer is option C. Agranulocytosis. When a patient with schizophrenia is prescribed clozapine, regular monitoring for agranulocytosis is essential. Agranulocytosis is a severe reduction in white blood cells that can be life-threatening. Monitoring. Question 11. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? Option A. Hypotension. Option B. Sexual dysfunction. Option C. Increased appetite. Option D. Tachycardia. The correct answer is option B. Sexual dysfunction. Corrected rationale. Sexual dysfunction is a commonly reported side effect of selective serotonin reuptake inhibitors, SSRIs. SSRIs can affect sexual function by causing issues, such as decreased libido, delayed. Question 12. A client is experiencing progressive changes in memory that have interfered with personal, social, and occupational functioning. The client exhibits poor judgment and has a short attention span. The nurse recognizes these as classic signs of which condition? Option A. Delirium. Option B. Mania. Option C. Parkinsonism. Option D. Alzheimer's. The correct answer is option D. Alzheimer's. The client's presentation of progressive memory changes, poor judgment, and attention deficits align with classic signs of Alzheimer's disease. Alzheimer's is a neurodegenerative disorder characterized by cognitive. Question 13. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist. Can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues. By addressing both the patient's expressed anticipation and the conflicting. Question 14. Which statement demonstrates a well-structured attempt at limit setting? Option A. Hitting me when you are angry is unacceptable. Option B. I expect you to behave yourself during dinner. Option C. Come here, right now. Option D. Good boys don't bite. The correct answer is option A. Hitting me when you are angry is unacceptable. Choice A. Hitting me when you are angry is unacceptable demonstrates a well-structured attempt at limit setting because it clearly defines the unacceptable behavior without ambiguity. This statement sets a clear. Question 15. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states. Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations, acknowledging and supporting. Question 16. Which behavior is consistent with therapeutic communication? Option A. Offering your opinion when asked to convey support. Option B. Summarizing the essence of the patient's comments in your own words. Option C. Interrupting periods of silence before they become awkward for the patient. Option D. Telling the patient they did well when you approve of their statements or actions. The correct answer is option B, summarizing the essence of the patient's comments in your own words. Summarizing the essence of the patient's comments in your own words is a key aspect of therapeutic communication as it demonstrates active listening and understanding. It shows the patient that their words have been. Question 17. When a patient with major depressive disorder is started on fluoxetine, what is the most important side effect for the nurse to monitor? Option A, weight gain. Option B, suicidal ideation. Option C, hypertension. Option D, hyperglycemia. The correct answer is option B, suicidal ideation. When initiating fluoxetine therapy in a patient with major depressive disorder, monitoring for suicidal ideation is crucial due to the increased risk of suicidal thoughts or behaviors that can occur, especially in. Question 18. Cognitive behavioral therapy, CBT, is often used to treat which of the following conditions? Option A, schizophrenia. Option B, bipolar disorder. Option C, post-traumatic stress disorder. Option D, generalized anxiety disorder. The correct answer is option D, generalized anxiety disorder. Cognitive behavioral therapy (CBT) is a widely used therapeutic approach effective in treating various mental health conditions. While CBT can be beneficial for different disorders, it is particularly well suited for. Question 19. When using therapeutic communication with a withdrawn patient who has major depression, an effective method of managing the silence is to: Option A, engage in a quiet meditation. Option B, ask simple questions even if the patient will not answer. Option C, use the technique of making observations. Option D, simply sit quietly and leave when the patient falls asleep. The correct answer is option C, use the technique of making observations. Using the technique of making observations is an effective method of managing silence when communicating with a withdrawn patient who has major depression. This approach can encourage the patient to engage and feel. Question 20. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A, limited language skills. Option B, level of cognitive development. Option C, level of emotional development. Option D, parental denial that a problem exists. The correct answer is option D, parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 21. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be: Option A, Nursing Interventions Classification, NIC. Option B, Nursing Outcomes Classification, NOC. Option C, NANDI Nursing Diagnoses. Option D, DSM-5. The correct answer is option D, DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 22. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, agranulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 23. What information should the nurse provide in patient education for a patient prescribed sertraline for major depressive disorder? Option A, take the medication with food. Option B, it may take several weeks to feel the full effect. Option C, avoid consuming grapefruit while taking this medication. Option D, regular blood tests are necessary to monitor levels. The correct answer is option B, it may take several weeks to feel the full effect. Patients prescribed sertraline for major depressive disorder should be educated that it may take several weeks before experiencing the full therapeutic effects of the medication. This delay in onset of action is. Question 24. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A, monitor the patient's vital signs frequently. Option B, keep the patient distracted with group-oriented activities. Option C, provide the patient with frequent milkshakes and protein drinks. Option D, reduce the volume on the television and dim bright lights in the environment. The correct answer is option B, keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable, providing nutrition, such as milkshakes and protein drinks. Question 25. A patient with post-traumatic stress disorder, PTSD, is prescribed prazosin. The nurse understands that this medication is used to treat which symptom of PTSD? Option A, flashbacks. Option B, nightmares. Option C, hypervigilance. Option D, depression. The correct answer is option B, nightmares. Prazosin is a medication often prescribed to manage nightmares in patients with PTSD. It works by blocking the action of adrenaline on specific receptors, which helps in reducing the intensity and frequency of